See, in India, the HPV vaccination uptake is extremely low. It's virtually not there at all. So there was a need for us to work with the groups that could increase the uptake. And we did a research. We started the research in 2019 on behavior change communication to see what works or what are the barriers that were there. One of the barriers, of course, was that they did not have the information, I mean the parents who were to vaccinate their daughters. And the most trusted source for them was the doctor. That's what the research results were. So for the physicians whom they would trust, we also found that it was the specialists of gynecologists, pediatricians, and general physicians. So for us, then we started, training or beginning to train, and that plan was to go to the medical societies in India. It was not tried before for HPV vaccination. So that's what our work has been, that we trained about 15,000 specialists in India on HPV vaccination, preparing the country for the rollout. See, in India, 25% of cervical cancer deaths globally happens in India, and this is a preventable cancer. And what WHO has set as a target is for elimination, that, this cancer particularly can be eliminated. For that, if you do 90% of vaccination, HPV vaccination of girls between 9 to 14 years, and screen 70% and also treat 90% of women with precancers and cancers. So naturally, if we are able to reach that target, then we'll be able to eliminate cervical cancer in the longer run, because these girls would not get the disease in adulthood. So that's primarily the reason why we are focusing, and we've been working with cervical cancer for a long, long time. We have enough evidence there which says that the vaccine is safe and effective, it works. So that's why India needs to focus on HPV vaccination. The vaccine has been licensed in India in 2008, and it is almost like more than 15 years now. Despite that, the uptake has not been very, very high for several reasons. One being that people are not as aware of cervical cancer. If you don't know about a cancer, then you would not know about protection. How do I prevent myself? Because you're not interested either. And these are new discoveries, which was not there earlier. So the mothers are not aware of the vaccine because they were never vaccinated. So this is a newer vaccine. And generally for cancers, you don't have a vaccine. This particular cancer has a virus linked to it, and that's the reason why you have a vaccine. But other cancers don't. So people don't have a concept that to prevent a cancer, you can actually vaccinate. So these are new information. So the people at large are not as aware. That's one of the things. Second is cervical cancer survivors also are not as visible in India. There's stigma. So you don't know as much about cervical cancer as well, unlike other cancers. So these are reasons, and also government needs to roll out prevention programs, which the government of India doesn't do as much. The focus is on treatment. That is the precise reason why prevention has not really picked up the way it should have. But we're trying to, and many groups in India are trying to push it through as much as possible so that we don't get the disease. It's a poor country, so we cannot let people die prematurely and go to a later stage when they have to spend a lot of money and move towards poverty. So which is the reason why prevention is what we need to work on or focus on in India. See, NGOs, or these are organizations, smaller organizations. So for us, like Cancer Foundation of India, one of the strengths that we have had over the years is to work with the government and plug the gaps that are there, help them restructure their programs or strengthen their programs, not run a parallel program, because we will not be able to sustain that, but rather feed into the bigger program. That's one. Second, building evidence, right? Advocacy is one of the areas. So the kind of work that we have done, especially in HPV vaccination, what we can talk of is we are part of the IARC study on dosage study that is there for the past 15 years. So what India has its own evidence, number one. It has been able to contribute to the dosage study when the 3 came to 2 and 2 came to 1 now. So one single dose works for HPV vaccination. So Cancer Foundation of India as an organization has contributed to that data as well by being one of the partners of IARC. We work with advocacy, so we have the first state in the country which rolled out HPV vaccination in India. So it was our advocacy that we have done. So we have tried to act as a pressure group. At times, we have also tried to act as the group that generates local evidence. which feeds into the bigger pool of evidence in the country, because many of the evidence in India that you get is from the West. So, which is one of the things we think, and restructuring, as I said, is one of our stronger areas of work over the years. Well, I think generally that, countries like India, where the disease burden of cancer is very, very high, the focus should be on cancer prevention, because you don't have as many super specialty hospitals across the country. So every time when anybody gets cancer, most of the time it is diagnosed very, very late, mostly in stage 4, 3 or 4, and it becomes almost impossible to treat or cure. You don't have that many government hospitals. People have depended on private hospitals where the cost is exorbitant when you go to stage 4. And they also don't survive. So people generally have a perception in India that if you get cancer, you die. So there is no point of treating them. But people don't have the concept that people will survive if it is diagnosed early, or it can be prevented. So naturally people don't work with prevention. Or common people, like if they're using tobacco, they don't see a purpose of giving up, because people will die anyway. It's very important that government and organizations, the CSOs, should work more and more in cancer prevention so that it's diagnosed early and those lives could be saved and premature deaths could be arrested.